An aortic dissection is very serious and needs immediate expert treatment. The specialized heart team here at Cleveland Clinic in Florida is renowned for repairing this life-threatening condition. Dr. Polanco, what is an aortic dissection and who's at risk?
An aortic dissection is a tear in the wall of the aorta, which is the largest blood vessel in the body. When this happens, the layers of the aorta split apart, and this is life-threatening. Luckily, aortic dissection is quite rare. However, men ages 40 to 70 are most at risk, and people with the following conditions: high blood pressure, heart or connective tissue conditions, history of smoking, family history of aortic disease.
What are the symptoms?
Symptoms include sudden chest and back pain, shortness of breath, dizziness or fainting, weak pulse or low blood pressure, and stroke-like symptoms. At Cleveland Clinic in Florida, we have an expert team in aortic dissection. Early detection and treatment, which often includes surgery, increase chances of survival.